Hello, welcome to my presentation on testicular cancer. My name is Rebecca Edwards. I am a student at Liberty University School of Nursing in the DNP to FNP program. This presentation is for NURS711 pathophysiology. My presentation on testicular cancer is case study number 74 in 100 case studies in pathophysiology. Patient case introduction. The patient is a 29-year-old white male. The patient complains of a, quote, heavy sensation in his scrotum. The patient discovered a small distinct lump on the surface of his right testicle. It is important to know that the etiology of testicular cancer is multifactorial. It is comprised of various genetic and environmental factors. According to the World Health Organization, there are 5 classifications of testicular cancer. Number 1, germ cell tumors, or TGCT, testicular germ cell tumor. Germ cell tumors are derived from gametes of the embryonic gonad and may be malignant or benign. Number 2, derived from germ cell neoplasia in situ. This includes seminomas, post-pubertal yolk sac tumor, and teratoma. Number 3, germ cell tumors unrelated to germ cell neoplasia in situ. This includes pre-pubertal yolk sac tumor. Number 4, sex cord and stromal cell tumors. And number 5, miscellaneous nonspecific stromal cell tumors. The risk factors of testicular cancer. Cryptorchidism is the most consistent risk factor and increases the risk of the disease 5 times. Family history, testicular trauma, high maternal estrogen level, and infections such as HIV, Epstein-Barr virus, CMV, HPV, and paravirus B19 are also risk factors associated with testicular cancer. The epidemiology of the disease. Testicular cancer is the most common solid malignancy in young adult men. It accounts for approximately 1% of newly diagnosed cancer in men worldwide. In 2021, in the United States, there were an estimated 9,470 new cases of testicular cancer and 440 deaths related to testicular cancer in the United States. The highest mortality rate from testicular cancer occurs in Western Asia. Worldwide, the incidence of testicular cancer is 74,458 and 9,334 deaths. Whites, Hispanics, and American Indian or Alaskan Natives have the highest rates of testicular cancer. With effective treatment, the overall 5-year survival rate is 97%. Testicular cancer pathology at the cellular level. When looking at germ cell neoplasia in situ, we see that it is the precursor to malignant testicular germ cell tumors. Germ cell neoplasia occurs when the gonocytes fail to differentiate into spermatogonia. Please see this image that I have included below from Spiller and Bowles for an image of this failure to differentiate. The undifferentiated cells only attain invasive properties after hormone changes occur during puberty. In seminomas, this consists of germ cells that are transformed but are blocked in their differentiation. And embryonal carcinoma cells, these are undifferentiated stem cells. Yolk sac tumors, this is the differentiation of cells that occur outside of the embryo. This can occur pre or post puberty. Teratomas have somatic cell differentiation. Back to our case study. We can see the clinical manifestations of testicular cancer in the example in our case study. When looking at subjective data, we see that the patient states that he feels a small, distinct lump on the surface of his right testicle. He also states he feels a heavy sensation in his scrotum. The patient denies any swelling or abnormal lumps in other locations. The patient also denies the following: fatigue, headache, vision changes, dizziness, cough, abdominal or chest pain, difficulty breathing, seizures, difficulty swallowing, or back pain. On a physical exam, we see the following: the abdomen is soft, non-tender, non-distended, and has normal active bowel sounds. No masses are palpable. Genitourinary. External genitalia are normal with no enlarged inguinal lymph nodes noted. The skin is soft, intact, warm, and dry. No evidence of rash, ecchymosis, petechiae, cyanosis, or lesions. On exam, the following vital signs are collected. The pulse is 80 and regular sinus rhythm. Respiratory rate is 16 breaths per minute and unlabored. Blood pressure is 115/75 and temperature is 98.6 degrees Fahrenheit. Diagnostic tests and labs. When attaining a complete blood count, we see the following. The red blood cells are 4.8 million per cubed millimeter. White blood cells are 8,100 per cubed millimeter. Platelets count is 41,000 per cubed millimeter. Alpha fetoprotein is 71. Beta HCG is 3. The role of the advanced practice nurse. When practicing as an advanced practice nurse from a Christian worldview, the nurse will approach each patient with love. In Genesis, we read, "So God created man in his own image. In the image of God, he created him. Male and female, he created them." In John 15:12, we read, "My command is this, love each other as I have loved you." The role of the advanced practice nurse practicing from a Christian worldview is to treat each patient as wonderfully made in God's image and to demonstrate God's love by loving them as he loves us. When providing care for our patients, James 1:5 tells us, "If any of you lacks wisdom, he should ask God, who gives generously to all without finding fault, and it will be given to him." The advanced practice nurse should seek wisdom from God when diagnosing and treating patients. This is through each step of our care with the patient, from the comprehensive physical exam to diagnostic testing, laboratory testing and interpretation of test results, diagnosis, and treatment and follow-up plan. Finally, the role of the advanced practice nurse practicing from a Christian worldview is to tell. The ultimate goal of the Christian advanced practice nurse is to spread the love of Jesus and his plan for salvation to the world. Mark 16:15 tells us, "He said to them, 'Go into all the world and preach the good news to all creation.'" Now that this case study has been presented to you, I would like for you to please consider 3 questions. Question 1. Identify one abnormal laboratory blood test result that is consistent with a diagnosis of testicular cancer. Question 2. Do you suspect that this cancer is in early, intermediate, or advanced stage? Explain your answer. And question 3. What is the probability that an orchiotomy alone will be curative in this patient? Please see this page for my references, and thank you for taking the time to listen to my presentation.